Good evening, everyone. Thank you so much for joining us for Vaccinate the Heartland 2025. My name is Kylie Hall, and I have the honor of emceeing tonight's event. I am coming to you from the great Heartland state of North Dakota. But what's great about technology is that wherever we are from, we all get to come together tonight to celebrate the value of vaccination. Vaccinate the Heartland has become an annual event hosted by Midwest Immunization Coalitions. So we are 11 states strong, and we are just so proud of the ways that we show up, support each other, and support vaccination and healthy communities across the Midwest. So tonight we are going to be hearing from vaccine experts, legislators, community leaders, survivors, healthcare providers, youth ambassadors, and also patient advocates. It is going to be quite the celebration. So a few housekeeping items just before we get started. So the chat is turned off in this webinar, but we do encourage you to ask questions using the Q&A function in your Zoom toolbar. And then we'll be monitoring the Q&A throughout the event to try and respond to as many questions as we can in real time. During this event, we do ask that all dialogue be respectful and positive. So our first guest for the evening is none other than Dr. Michael Osterholm. Dr. Osterholm needs no introductions. He holds many titles. You may have heard of him most recently as the director of CIDRAP, which recently launched the Vaccine Integrity Project to safeguard vaccine use across the United States. So Dr. Osterholm, thank you so much for joining us tonight. You can get started.
Thank you very much. It's Mike Ostrom. Very good to be with you. As many of you know, I direct the Center for Infectious Disease Research and Policy at the University of Minnesota. And more recently, probably known because I lead the Vaccine Integrity Project, an initiative out of CIDRAP that really got its genesis last November when some of us recognized the incredible challenges we were likely to have with Mr. Kennedy to be nominated as HHS Secretary and the President supporting him as such. When that came to fruition, where he was in fact approved, and shortly thereafter dismissed the entire ACIP, we began a very active program with support from the Alumbra Foundation, in which we did a series of 6 major focus groups. So some of you on this screen attended those, and looking for what is it that we could do to help support the work that the CDC and ACIP once did, knowing that they no longer were going to be able to do that and be a trusted voice. We came up with 8 different pillars of information. We've taken on 3 of them. 2 I'll just quickly discuss and then get more in detail on the third one. First one is mis and disinformation. We're launching a major initiative to be able to provide timely, meaning same day information on that which comes particularly from our federal government, which is just frankly outright wrong, not scientifically correct. This third one area we're working on is an issue of collaboration and how that we might facilitate, for example, with the medical societies, the groups we're working with a lot right now, and some of the work that groups like yours are doing. The third one, which has been the biggest lift, has been the fact that once ACIP was no longer in a position to provide the kind of credible and detailed information that's provided over the years in making vaccine recommendations, we took it upon ourselves with 26 different individuals involved from a number of different medical centers. And we actually did the Prospero protocol review of COVID, RSV, and influenza vaccines for the fall vaccine season. This has involved many thousands of hours of work, over 1,700 papers, double reviewed. And at this point, we have now handed over a great deal of that information to the medical societies, American Academy of Pediatrics, ACOG, others have used that information as the basis for their recommendations, which of course differ from ACIP. We are finishing this project up in the next 2 weeks. We will have basically all the information publicly available. We have developed an app that you'll be able to use that you can do all the analysis, every paper, every analysis is at your fingertips. You can do whatever you want with it to look at this. In addition, we are working on an infographic that will be available shortly that will have every age group listed out, or risk factor group, and then there'll be a table across from it which will actually allow you to actually arrive at that website to click on it for that organization's recommendations, whether they be any of the medical societies that we see. We'll continue to do that. We're looking right now at the additional vaccines we're going to be taking on in the future. And for the foreseeable future, we will continue to provide you all and the medical societies with the current most updated review on vaccines. So that I think covers it. I want to add, we do have a number of viewpoints, 7 different viewpoints that have been published on our site, extensive discussions of issues that we believe are of real importance. I urge you to go visit the Vaccine Integrity site if in fact you have an interest in this. Also, the results of our survey, as well as the initial results of our vaccine effectiveness and safety data that I just mentioned will be there. So. And then finally, I see, Melissa, thank you. You put this up. This was an op-ed that was in this Stat News earlier this summer when we were really making this initiative known to the public. So with that, be happy to end or take any questions if you have them.
Great. Thank you so much, Dr. Ostrom. 1, for your flexibility, but 2, for starting us off this evening. That was really great. And I just want to say that the work you're doing at CIDRAP and with the Vaccine Integrity Project is really important. And we so appreciate all of your efforts there.
Well, thank you. And let me just say 2 things. One is that obviously vaccines are really, really good, but they're not great. What's great is vaccinations. And that's what you all are about, is combining that vaccine with the effort to make good go to great. And so thank you for that. That's really important. Today, I finished an episode of my podcast. We have 5 new states with measles cases this week. You know, it's going to be a forever challenge. And so keep going. And I would just close by saying, and following the great words of Ben Franklin, we must hang together. We surely shall hang separately. So I'm looking forward to hanging together with you guys.
Absolutely. Hang with you anytime. All of you. All right. Thanks so much, Dr. Ostrom.
Thank you.
We appreciate it. All right. Well, hard to follow Dr. Osterholm, but we are going to try. We our next guest tonight is Dr. Peter Hotez. I just mentioned briefly that he's a passionate vaccine advocate and advocate for vaccine equity as well. So we're so excited that Dr. Hotez is able to join us next.
Hello, my name is Peter Hotez. I'm a vaccine scientist and pediatrician, and in addition to developing new vaccines for diseases such as COVID or parasitic diseases, I also spend a lot of time countering vaccine disinformation. I got involved in that because I have a daughter with autism, and years ago wrote a book called Vaccines Did Not Cause Rachel's Autism, to counteract that opinion and explaining why there's no plausibility to it. In the meantime, vaccine misinformation has continued to accelerate, and we saw the damage from it this year in 2025 when we had an 8-month-long measles epidemic that began in my state of Texas and then spread to 3 or 4 other states, and it resulted in 100 hospitalizations and 2 needless deaths among school-age kids who didn't get vaccinated. And that's really why we have to care, because this is not an academic discussion or a theoretical discussion. 100 hospitalizations and 2 needless deaths this year, and this trend is only growing worse by the month. So I really appreciate your efforts to work with me and counteract vaccine misinformation, and good luck.
All right. Another great way to start the program, Dr. Peter Hotez. Our next guest for the evening is Alicia Stillman. Alicia is from the Emily Stillman Foundation. This foundation works to educate the public about meningococcal disease, and it's based in the Great Heartland state of Michigan.
Hi, everyone. My name is Alicia Stillman, and I'm from Michigan. I stand before you not only as the executive director of the Emily Stillman Foundation and the co-executive director of the American Society for Meningitis Prevention, but most importantly, as Emily's mom. My Emily was full of life. She was 19. She was smart, kind, and unbelievably funny. She was in her sophomore year at Kalamazoo Village, loving life, making friends, studying hard, and dreaming about her future. She called me one evening from her dorm room, and she said she had a headache, just a headache. Hours later, she was rushed to the hospital, and in 36 hours, my Emily was gone. No parent should ever have to endure that kind of loss, and no young person should lose their life when there is a safe and effective vaccine that could have prevented it. That's why I do this work. Together, we are raising awareness, educating students and families, and making sure that young people everywhere know the importance of meningitis prevention and the vaccines that protect against it. But we can't do this alone. We need each of you to be a voice, to take action, and to spread the word. Talk to your friends, your children, your schools, your communities. Vaccination is not just about protecting yourself. It's about protecting everyone around you. So I'm asking you, join us in this fight. Help us turn awareness into action and action into lives saved. To learn more and to get involved, please visit meningitisprevention.org. Together, we can make sure that Emily's story inspires change and that no other family has to experience what mine has. Thank you.
Hi, I'm Nini. I'm based out of California. I'm a science communicator and vaccine advocate. This past year's measles outbreak has reminded us of the importance of vaccination. Vaccines are public health's greatest paradox because when they work, we forget about the consequences of the diseases they were designed to prevent. They work so effectively, we experience nothing but the absence of disease, and that absence is everything, and it makes us take vaccines for granted. One misconception I hear a lot today is that children get too many vaccines compared to decades ago, but that framing is misleading. It makes it seem as if though that were a bad thing, but it really means we have chosen progress and prevention over disease, disability, and death. Think about it like air travel. Over the years, we've added systems of protection to make travel safer, and today we experience virtually zero commercial aircraft accidents every year. And here's the twist that most people don't realize. Despite protecting against many more diseases and having more vaccines, we actually give children orders of magnitude fewer antigens relative to 4 decades ago. Antigens are part of the vaccine that the immune system reacts to. The schedule in the 1980s exposed children to over 15,000 antigens. Today, children get fewer than 200 antigens in their whole schedule. That's amazing progress. So modern vaccines don't just protect us against many more diseases, they also lower the total immune system load. And that is science at its best: smarter, safer, and life-saving.
Hi, I'm State Senator Doris Turner, proudly representing Illinois' 48th Senate District. Today we're celebrating something that too often gets taken for granted: vaccines. Routine and up-to-date vaccination across every stage of life is one of the most effective ways we protect our communities. Vaccines prevent disease outbreaks, reduce illness and death, and save millions in healthcare costs every year. When people stay healthy, kids stay in school, parents stay at work, and our communities stay strong. From childhood immunizations to adult boosters, vaccines are a simple, safe, and powerful tool in keeping Illinois families healthy. Let's continue to support access, education, and equality in vaccination because prevention is protection. Thank you, and let's keep working together for a healthier Illinois and a healthier America.
Hello, everyone. My name is Nikki Budzinski, and I'm proud to represent Central and Southern Illinois in Congress. Thank you to the Illinois Public Health Association and the Midwest Immunization Coalition for hosting this important event. Coming together to share information and resources about the importance of vaccines is vital. Right now, anti-vaccine science deniers like Secretary Kennedy have been given a national platform and a power over our public health policies. That is deeply dangerous. We all remember what it was like at the height of the COVID-19 pandemic when we had no vaccine to prevent this deadly disease. We were isolated from friends, family, and community. Healthcare workers were pushed to the brink, and millions of Americans died. The development of an effective COVID-19 vaccine was our lifeline out of this crisis. Like many Americans, the pandemic made me realize that we cannot take vaccines for granted. They allowed us to get COVID-19 under control. They have eradicated horrific diseases like smallpox. They can prevent cervical cancer, and they are a pillar of public health. Getting routine and up-to-date vaccinations isn't only essential for your own health, it also protects people around you. It's an important responsibility that helps keep all of us safe and healthy. That's why I'm fighting to make vaccines accessible and affordable for all, especially in our rural communities where access to care can be a real challenge. By leading an appropriations letter to provide $1.13 billion for the CDC's National Immunization Program. After RFK Jr. fired all 17 members of the Advisory Committee on Immunization Practices, I sent a letter to top health insurance companies urging them to continue to provide coverage for vaccines currently recommended by the committee. I also demanded that the committee be reinstated. But you don't have to be a member of Congress to fight back against vaccine hesitancy and misinformation. You can talk to your doctor about what vaccines you and your family need. You can get your annual flu shot, and you can participate in rallies like this one. We all have a role to play in protecting our public health, and I will always fight for you. Thank you.
Hi, my name is Carly Leon, and I am from Northeast Ohio. I value immunizations because they not only protect me and my children, they protect our most vulnerable in our communities, and those are elderly folks, cancer patients, people undergoing chemotherapy, radiation, babies too young to be vaccinated, as well as those who have undergone a transplant surgery. Vaccinating has also kept highly communicable diseases at bay, meaning we don't have outbreaks that spread across the country like we used to prior to vaccines. And from a risk-benefit analysis, not vaccinating carries far more risk than the vaccines themselves. I also want to note that measles was eliminated in the early 2000s, and eliminated, that means there were no cases for 12 plus months. And that was due to the measles vaccine. As a parent, it also just makes sense to prevent something rather than to treat it. It is also costly. Your child gets infected with measles or the chicken pox or whooping cough. If you're a working parent and struggle to find childcare, you will have to stay home. And if you're a parent that doesn't have paid sick days, paid vacation days, it's going to cost you. So that is also something to think about. Vaccinating reduces the severity of the illness, and it keeps hospitalizations down, and it prevents deaths. I do remember a story back in June of 2015 where I read about a 6-year-old boy in Spain who was not vaccinated and contracted diphtheria. Now, of course, sadly, he ended up dying. But during all of that, he infected at least 10 other people in that area where he was. Now, those 10 people, even though they carried the bacteria, they did not suffer a severe bout of diphtheria. They were treated with antibiotics and confined to their homes. That is because they were vaccinated. Do right by your family and your fellow community members. Get vaccinated.
Hi everyone, my name is Philip Bitruskaya, Hepatitis B Ambassador with Illinois Public Health Association. Hepatitis B rates are very high among African American immigrants. It affects my community directly. I want to tell my peers about hepatitis B. Vaccines protect family, friends, and community. Without vaccination, hepatitis B can be deadly. Vaccine saves lives. It reduces stigma, fear, and suffering. My activities as an ambassador is to create awareness among African American immigrants. I travel around Springfield and other areas for outreach. I share information on testing, vaccination, and prevention using brochures and flyers I created, in which I discovered that many people are not vaccinated and tested. My personal story is I lost my maternal uncle June 2024 due to hepatitis B. Many people in my community are living with hepatitis B because they lack awareness, they are not tested, and they are not vaccinated. So these laws has motivated me to create awareness among African American individuals. Being an ambassador is an honor. I'm committed to raising awareness, encouraging testing and vaccination. Together, we can prevent the spread of hepatitis B. Get tested, get vaccinated. Let's save the world and stop the spread of hepatitis B. Thank you and remain blessed.
Good evening, everyone. My name is Maria Torres, and I'm the Health Equity Coordinator for Potawatomi County Public Health, as well as the CEO and founder of the Community Project. I'm here today to talk about something that is at the heart of our work in public health, vaccination, and why it is so critical for the health of our communities. I value vaccination because it is one of the most effective ways to keep our communities, especially our children, safe from preventable diseases. Vaccines do more than protect individuals. They protect everyone around them. When more people are vaccinated, the spread of diseases is limited, which is why vaccines are such an essential tool in public health. I'm also a proud member of Iowa Immunizes because of their tireless advocates for ensuring that vaccines are available and accessible to everyone in Iowa. Their ongoing efforts help us make sure that the vaccines we need are within reach of every individual across the state. And I believe their advocacy truly makes a difference. To me, health equity means that everyone, regardless of their background, income, or where they live, has equal access to health resources they need. That includes not only life-saving vaccinations, but also access to timely care and education. No one should face barriers when it comes to getting the care they deserve. And that's a core part of what we fight for every day. In my community, I lead efforts to ensure that populations, particularly underserved ones, have access to the vaccines they need. One project I'm particularly proud of is our partnership with Knock and Drop Iowa, where the focus on raising awareness about the importance of the HPV vaccine. Our goal is to educate people about the value of preventative health measures and the power of vaccines to save lives. We're also doing important work to support the Hispanic and Latino communities in accessing the vaccines they need. We know that these communities sometimes face unique challenges, whether it is language barrier, mistrust of the healthcare system, or lack of information. That's why we are currently assisting both adults and children in these communities through dedicated vaccine programs, ensuring that they have the information, support, resources that they need to make informed decisions. When we talk about achieving equitable access to healthcare, it means that everyone, regardless of where they come from or their circumstance, has the opportunity to get vaccinated when they are ready. Vaccine equity doesn't just happen by chance. It is about making sure that we have policies in place that remove barriers to care, and that vaccines are affordable and accessible for everyone. The best health outcomes happen when we follow national clinical guidelines, like those set by the American Academy of Pediatrics and the American Academy of Family Physicians. And when providers use tools like immunization registries to make sure vaccines are given on time. These practices are essential in reducing preventable disease transmission, which is key to keeping our community safe. Higher levels of vaccination is a community lead to higher immunity, meaning fewer people are at risk of getting sick and diseases don't spread as easily. That's why it is so important for us to work together, collaborating with provider groups, health plans, and policymakers to ensure our communities remain safe and free of disease. Thank you so much for joining us tonight on tonight's rally. Your work and commitment to vaccinating the Heartland are truly invaluable. Together, we are creating a healthier future for all of us here in Iowa. Thank you.
All right. Well, you guys, it is so fun and so amazing to see all the work that is happening across the Heartland to help get people vaccinated. I just want to say thank you again to all of those who are sharing their positive vaccine messages with us this evening. Our next guest is Dr. Edward Nierenberg. Dr. Nierenberg is an outspoken advocate for vaccines online, having built a large following across social media. He is the author of Deplatformed Disease, which is a popular blog addressing medical misinformation in depth.
It would be hard to overstate the importance of advocating for vaccines, especially in our current era. The stakes are not abstract. Measles, once eliminated here, is finding room again wherever coverage slips. Undermining trust in the perinatal hepatitis B vaccine turns preventable infections into lifetimes of cirrhosis and cancer. Attacks on mRNA platforms score points online and also cripple our ability to respond to the next public health emergency. What actually works? It's trusted messengers on the ground. Meet people where they are, physically and cognitively. Ask what they care about, not just what you want to explain. Translate risk without drama. Be clear about uncertainty. And do not ever bend the facts to win an argument. I use a simple self-check in these tough conversations. I ask, if I were wrong, how would I want to find out? And then I offer that same dignity to the other person. I ask what evidence might change their mind, and I answer that question for myself too, which helps keep the conversations cooperative instead of combative. I advocate because I've seen what happens when people get accurate information in time. Fear gives way to choice, and choice changes outcomes for the better. I advocate because I've also seen what happens when lies move faster than truth. We can't control every variable, but we can control whether the next family hears from a trusted neighbor or from a grifter. Give people back their choices. And if you already do this work, keep going. Someone you'll never meet will be alive, will have a better day because you did.
Hey, Congressman Sean Casten here, and thank you so much to the Illinois Public Health Association for all your good work and to making sure that people get vaccinated. I can't believe that in 2025 we have to say this, but get vaccinated. It is maybe the most effective public health measure of all time. Spanish flu back in the 1900s killed more people than World War I did. People are alive today. People don't die from measles. People don't die from all these diseases, HPV vaccine, all the vaccines we get. People don't die from those diseases that used to kill our ancestors because we have vaccines. They protect you, they protect your family, they protect your loved ones, they protect the person sitting next to you on the L. And look, the one thing we know for certain is that the one thing that vaccines have been absolutely proven to cause is adults. So get vaccinated, be an adult. I want you to stick around here. Thank you.
Hello, I'm Cheryl Larson, President and CEO of the Midwest Business Group on Health. We are an employer coalition representing national and regional, mid, large, and jumbo self-insured public and private employers who are seeking solutions to better manage the high cost of healthcare as well as the health and productivity of their covered populations. I want to share a statement with you that we are sending to all of our members, our sister coalitions, there are about 40 or 50 across the country, on employer actions to ensure evidence-based vaccine science and critical access for employees and members. Here we go. We uphold that prevention is crucial in healthcare benefits and in society, as it significantly reduces costs, improves overall health, and enhances quality of life. As a consortium of over 150 employers representing between 4 and 5 million lives, and in collaboration with the business coalition community across the country, we share best practices and policies to work towards a simple but vital mission. My message is to protect the health of all through evidence-based immunization policies and practices. In an era of misinformation and politicized health policies, MBGH commits to evidence-based vaccine science, and we invite like-minded organizations such as self-insured and fully insured employers, employer coalitions, health systems, public and private sectors, even chambers of commerce, to join in our efforts to protect employees and their families. We strongly support vaccinations as a cornerstone of public health, a credible and robust example of the power of scientific research, and a vital tool in the fight against vaccine preventable diseases, especially as communities face renewed threats from measles, pertussis, and other unnecessary illnesses. We commit to upholding equitable access to vaccines to safeguard a healthy and productive workforce and reduce the costly impacts of absenteeism and presenteeism. There has never been a more urgent time for us to work together. Together, we can save lives. A little bit more on our commitment to evidence-based vaccine science. As the national conversation becomes increasingly divisive and confusing, we want to give employers the most accurate information when making decisions about protecting their employees from vaccine preventable diseases. And we affirm our commitment to the following facts. I have 6. Vaccines are one of the most rigorously tested and closely monitored preventive medical advances available to protect the health and safety of our covered populations. Rigorous and thoroughly monitored vaccine safety systems in the U.S. have high standards and represent one of the most advanced systems in the world for assessing vaccine safety. Routine vaccination is necessary to protect our communities from the spread of infectious disease, including those whose immune systems may be impaired and unable to respond to vaccination. Routine vaccination is critical to protect our employees and their families from not only the spread of infectious disease, but also to help prevent 7 different cancers. Vaccinations reduce suffering and long-term consequences of disease and reduce disease burden on the already at capacity healthcare system. And finally, vaccinations benefit employers by reducing the employee time missed from work due to illness for themselves or their families, resulting in improved productivity. Immunizations have eliminated devastating diseases such as smallpox from the world, polio from the Western Hemisphere, and have significantly reduced the impact and harm of many vaccine preventable diseases. Vaccine recommendations must be rooted in empirical, unbiased, and peer-reviewed steps. And we have some steps for you to further support your efforts. 1, design your medical and pharmacy benefits to ensure routine vaccinations are covered without cost sharing. 2, allow provider choice so that employees and their families may see their primary care provider or a pharmacist for routine vaccinations. And 3, offer vaccinations in convenient in-network locations such as pharmacies, doctor's office, and during worksite and on-site clinics. That includes the clinical guidelines, the clinical practice guidelines, and recommendations from the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Obstetricians and Gynecologists, and the Vaccine Integrity Project. And make sure, if you're interested in this statement, to share it with your employees and families through various communication efforts such as newsletters, websites, social media. If you would like a copy of the MBGH statement, along with links to these important resources, please email info@mbgh.org. Feel free to customize your own statement to meet your stakeholder needs. Let's do this together to support our employees, community members, family members throughout the nation. Thank you for your time today.
That was great. We've had some wonderful messages tonight, and I just feel like time is flying by. Thank you all again for being here at Vaccinate the Heartland and celebrating the power of vaccines with us. Our next speaker is Dr. Nathan Boonstra. Dr. Boonstra is a general pediatrician in Des Moines, Iowa, and he has a passion for public health and vaccines. Dr. Boonstra, I see you're on. Take it away.
Thanks, everybody. I am pleased to have this opportunity to talk. I'm going to actually kind of shift gears a little bit, and I'm going to talk about. So I'm a general pediatrician here at the Children's Hospital in Des Moines, and I'm also chair of Iowa Immunizes, our state's immunization coalition. And rather than talk about some of the stuff that I talk about a lot, which is myths about vaccines and stuff like that, I get to take this opportunity to talk a little bit about what to expect for parents what parents can expect at a vaccination visit. And I only have a few minutes, so this is just going to be a few highlights. There's a few things I think are kind of interesting to talk about. When I have families wondering about vaccinations, they're wondering, one of the first things is, okay, how many vaccines, how many shots, how many pokes are we talking about? And if we're talking about, say, a 2-month-old visit, that's one of the first visit where you get kind of the routine set of vaccines at 2 months old. Usually that works out to just 2 or 3 pokes. In my clinic, we have just 2 vaccines that we give that are actual shots, and then we give 1 oral vaccine that protects against rotavirus through the wintertime. Those 2 shots, though, protect against 7 different diseases. So we're fortunate that we don't have to do lots and lots of pokes and cause more pain to protect against a number of diseases. At 12 months of age or 15 months of age, that's when we usually give that MMR vaccine, that measles, mumps, and rubella that protects against measles and those other diseases. And so that's a little bit later. And that can be given with other vaccines at that same visit as well. One of the things that parents will, I'm going to jump around my bullet points a little bit. What do parents, what to expect afterwards for a baby? Most of the time, after getting their shots, babies kind of go on with their day, and not a lot is necessarily different. They may be fussier. The vaccines can make babies feel sore in the legs, and so they're not able to express that the way that you and I can, and so they may certainly cry and cry excessively afterwards. But actually, anything more serious than that's pretty rare. Occasionally you see a fever, but honestly, most vaccines don't cause a fever most of the time. In fact, anytime that there's at a 2-month visit, I tell my families, if you have if your baby has a fever, and a fever is 100.4 degrees, ideally a rectal temperature, but if it's underarm, that's okay. I want to call. I want to know if you feel like your baby's sick. I want to know about it, especially after that 2-month visit. But it's never wrong to call the doctor if you're worried that your baby's not feeling right. But fevers themselves are actually pretty rare. One thing that's actually more common is that babies can sleep. They can take a super long nap after vaccines. As their immune systems are working, their body likes to rest. And there's actually some literature that suggests that a nice long nap after vaccines is actually helpful to help the antibody production and whatnot. With that MMR vaccine at 12 months of age, we do sometimes see a little bit more likelihood of a fever or rash, but that usually actually comes 1 to 2 weeks down the line. And again, if you have any concerns at all, make sure to talk to your doctor about it. Call them. Don't hesitate to do that. All right, some resources. I only have a couple of minutes, but it's good to, one of the questions is, how can I get my questions answered? And hopefully at the visit, your doctor is taking that time and should know that questions are good. It's important that families feel confident and that they have their questions answered. But if you don't necessarily feel like there's time at that visit to get all your questions answered, these are some resources that we like. I especially like Children's Hospital of Philadelphia, Vaccine Education Center. If there's a myth out there, they probably looked at it, but also get in, check in with your state immunization coalition. They probably have the best resources for you. And then the next slide, please. And how can you get a child ready for a vaccine visit? Well, a few pointers. One is to always speak positively about vaccines. And that means that we always want to make sure that if the child's worried about vaccines at that visit, if they're older, they're kindergarten age and they're going in and they're worried about shots, that you don't tell them something that's not true. You don't tell them they're not getting vaccines. You don't trick them or fool them. You're always being honest about vaccines. But you're also speaking positively about why it's so important. You also never assume that a child is or isn't getting a vaccine at any visit, even a sick visit. You don't want to say you're absolutely not getting a vaccine, because then you don't realize that something's due, or there's a seasonal vaccine, there's a flu shot that's due. And so you want to make sure that you're not kind of shutting the door on that with your child. But also there are books and resources out there, and I actually want to share one with you that we just developed at Iowa Immunizes and Iowa Public Health Association. And so that's a children's book that we developed this year called Bye Bye Big Sick. And we have that in kind of the kindergarten age books for a child who's going in to get immunizations pre-kindergarten, but also board books for younger children. And we have it in English and Spanish. And it's a great resource for kind of going through, takes the child step by step about what vaccines are and what they can expect at the visit. And I think it allows you to have those conversations in language that's appropriate for their age. So if you're interested in that and you want to find out more, you can check it out on our website, iowapha.org/big-sick. And also I believe next slide. We have some t-shirts as well that we partner with a great t-shirt maker called Raygun. They made the shirt that I'm wearing, and you can kind of check that out if you wish as well. Now, it is my pleasure to introduce friends of mine who are also from Iowa, Amber and Ireland McCarthy, and they would like to take some time to tell Aisley McCarthy's story.
Hi, I'm Amber McCarthy. This is my daughter, Ireland McCarthy. We are from Elkhorn, Iowa. I lost my daughter, Aisley, to influenza in December 2014. She was 3 years old. She was a happy, healthy, typical 3-year-old girl. She loved Barbies, Frozen, Olaf, following her older sister around constantly. And she fell ill, and we took her to our local clinic where they swabbed her, and she was positive for influenza A and influenza B. And within 48 hours, she had passed away. I am now on the board of directors with an organization called Families Fighting Flu, where I was able to find other families that have lost a loved one to the flu. In addition to this, we also now host Aisley flu clinics annually in 5 towns in memory of her. We try to educate the community on the importance of the flu vaccination and how deadly the flu can be.
Our goal is to connect with communities and inspire others to take flu prevention seriously. Through this work, I've seen firsthand how powerful storytelling and advocacy can be in changing minds and saving lives. Families Fighting Flu is more than just an organization. It's a community of families who have turned their grief and pain into action, working tirelessly to protect others from experiencing the same pain we have gone through. My sister Aisley's story is just one of the many that demonstrate how dangerous influenza can be. Through my work with Families Fighting Flu, I've been able to honor her memory and help spread the message that prevention saves lives. I encourage each of you to join us in this mission. Get your flu shot, educate yourself on how severe the flu can be, and take prevention seriously. Share the importance of flu awareness with your community, because together we can make a difference. One conversation, a step to prevention, can save one life at a time.
Thank you.
All right, everyone, we are nearing the end of our time together. That was amazing. Just what an amazing program that we've had so far. But that flu story, man, that really tugs at a mom's heartstrings. Before we wrap for the night, though, we have one more amazing group of individuals that we are going to hear from. We're going to hear from Ella Johnson and Zuli Garcia. They are going to talk about their HPV vaccination work. Ladies, I see you're on. Welcome. Thank you so much for joining us.
Perfect. Hello, everyone. Thank you so much for having me. My name is Ella, and I am the Project Manager of Education and Programming at HPV Cancers Alliance.
Hello, everyone. I'm Suli Garcia with Knock and Drop Iowa and a cervical cancer survivor.
Awesome. Thank you. Zuli, tell me why you are passionate about HPV cancer prevention.
Ella, I'm passionate because my story wouldn't be happening right now if I would have received the information and the HPV vaccination and information that I needed when I was diagnosed. I realized how many lives could be saved with just giving the right information out and promoting it and making sure that people are aware of it. So for me, it's turning my pain into purpose. And I think that's what my passion comes from. So, Ella, now I have a question for you. What does the HPV Cancer Alliance mission mean to you?
Sure. So, in short, our mission is to spread knowledge and save lives. And to me, this really means giving people accurate, accessible information so that they can take control of their health and at the end of the day, prevent HPV-related cancers. In doing so, we want to make sure that no community is left behind, whether because of stigma, identity, or various access barriers. Our mission also to me means bringing people together like survivors, clinicians, researchers, and advocates because we know that ending HPV related cancers requires all of us working together. And lastly, I think our mission is actionable, whether we are advancing policies together, highlighting emerging science and innovations in care, or just building educational materials, we really aim to always spread knowledge and save lives. So that is a little bit about the work we do. And Zuli, I'd love for you to tell me about the work that you do in the community with the Vax Talks that you lead.
So we have some back talks here in Iowa where I go into not just, in the city, but metro areas and the rural areas. And we meet people where they feel comfortable. Is that churches, school, community centers. We bring trusted information. We partner with others to make sure that it is trusted information for the community in both Spanish and English to break down the myths and answer real questions. I want people to hear my story and feel comfortable to ask the questions of, is this something I should be doing? And it's not just a lecture, it's a conversation. It's feeling comfortable and in a safe space. And that's how we build trust. And that's how families make informed choices by listening, getting the information, and then choosing from there. So now, Ella, what resources exist for patients and caregivers?
Sure. So there are so many excellent resources available for patients and caregivers. And it's always really important, first and foremost, to turn to information that is backed by science. Organizations like the CDC and the American Cancer Society are always great, trusted starting points. But additionally, at HPV Cancers Alliance, we also provide a wide range of resources that really break down the basics of HPV. What is HPV? How does it affect the body? How to get vaccinated? How to ask your doctor for the vaccine? And even how to talk to your loved ones about HPV. And we have these resources because we know that HPV can feel really confusing because it's both a common virus and a cancer-causing agent, and there's a vaccine for it. So our goal is to demystify it and give people clear information that they can use to make confident decisions about their health, both independently and with their healthcare providers in terms of shared decision making. So check out HPV Cancers Alliance. And with all of that said, Zuli, in closing, what is your call to action for our attendees tonight?
My call to action is simple. Use your voice, share what you've learned tonight with your family, your neighbors, your loved ones, your community. Encourage someone to get vaccinated, to go get screened, to ask questions. Every single conversation counts and it matters because every single life matters. Together, we can stop HPV cancers before they start. So, thank you, Ella. I really appreciate you joining us joining me tonight to promote the importance of the HPV cancer prevention through vaccination and screenings. Thank you all for connecting with us tonight. Let's build healthier communities together. Let's work together to vaccinate the heartland. Thank you.
Thank you.
What an awesome message to end on. Thank you both so much. Well, everyone, that is a wrap on Vaccinate the Heartland 2025. I want to thank everyone so much for joining us this evening. We are going to be done just a few minutes early, and so I'm going to challenge you to do two things with that time. One, you can either make a plan to go get your respiratory virus vaccines for this fall, or two, it's an and or, you can text 2 or 3 of your friends and family members to see what their plan is for their respiratory virus vaccines for this fall. So that is my challenge to you with a few extra minutes here this evening. I do want to say a really special thank you to our planning team and all of our speakers here tonight. Your efforts do not go unnoticed, and they are so appreciated. A recording of tonight's webinar and the slides will be available through all of your state immunization coalitions in the near future. So when you all registered, you provided an email and then which state you are from. So be on the lookout for that from your state coalition. And then on the screen, you are seeing a slide with all of the different resources that were shared this evening. Your state coalitions will also be sharing that information with you in a follow-up email. So again, just be on the lookout. And then lastly, I just wanted to say thank you to everyone. Thank you for coming together to celebrate vaccines. The passion tonight was evident. It was so contagious. I know that we are in some challenging times, but we really need to remember that our work matters and it really impacts the work of those that we serve. So I hope you'll continue to do the hard work in the days, weeks, and months ahead, knowing that we have the science on our side and that the ultimate goal is healthy communities that are free of vaccine preventable diseases. When you need to, reach out to your fellow vaccine champions, lean on them, support them, stay strong. We are in this together. Let's work together, and we're going to vaccinate the heartland. So thank you all so much for being here for Vaccinate the Heartland 2025. We will see you all next year.